Cease. I'm one of the nurses, and I'm going to talk to you today about Jackson Pratt drains. We call them JP drains for short. They work by suction. This part with the holes is inside of you, and it is stitched in with one stitch. If the bulb looks like this, it's not working. It has to be compressed and plugged. So I'm just going to simulate this so you can tell it's working that way. Your job is to empty this 3 times a day and keep track of it. You may be discharged with one or several JP drains, and you need to keep separate totals of each one of these. This little sheet kind of reviews what I'm going to be saying. We also have this other drain sheet which holds up to 6 drains, and you empty each one 3 times a day and total it. The important thing is that you come in with separate totals for each drain, and when you have less than 30 cc's of drainage in a 24-hour period, 2 days in a row we can pull that drain out. So let's just review how to empty the drain. You are going to have a bottle of isopropyl alcohol at home and some cotton balls. You will release the suction, and there's going to be blood in the bulb. You squeeze the blood out into the specimen container, which will be provided to you by the hospital or our operating room, recovery room nurse. There are measurements on the specimen container, either cc's or ounces. We prefer you use cc's. It's a smaller amount of measurement and will be more accurate for determining how much drainage you have. So you're going to unplug the drain. You're going to squeeze out the blood that's in here into the container. Do not ever disconnect anything. All you will be doing is unplugging it. If you have a little bit that can't come out, don't worry about it. Then you will look and see how much is in here. You will write it down under your sheet. Let's say for drain number 1 for morning. You will rinse out what's in here so you can use it again. Then what you need to do is re-squeeze to reinstitute the suction and wipe off both spout and plug with the alcohol. Plug it back up. Now each drain is going to be stitched in with just like 1 or 2 stitches, so we don't want you emptying this from across the room because you could pull it out. While you're in the shower, you could put something around your neck and loop this through there with the safety pin or like a piece of string or an old ugly necktie of your husband's, whatever you want to use. And then when you get out of the shower, you can go ahead and put it back in your vest if you got one with pockets, or pin them to your top. It's always easier to keep them pinned to your top because then whenever you use the bathroom, you won't have to unpin them and move them from your pants back up to your top. It's very important, like I said earlier, when you come back in for your post-op visit to bring your drain sheet. Otherwise, we are not going to be able to determine which drain needs to come out. You might want to take a pain pill if you want before you come in. The discomfort only lasts for maybe up to a minute, and it's a burning sensation. So what we will do is just clip the stitch that's holding the drain, and I usually have the patient take a deep breath in and blow out like you're blowing out 100 birthday candles, and then we pull the drain out. And like I said, then we put a little pressure on there and you feel a little burning, but it's not more than 30 to 60 seconds, and then it goes away. Now the dressing we put over that site is going to be a piece of gauze and tape with a little antibiotic ointment on it. You need to keep an eye on this dressing. You will probably still have some drainage coming out, which is perfectly fine. You just need to keep changing it, and it will only last a couple days. It's more important that the drainage comes out instead of staying in if we would have sutured the whole clothes or steri-stripped it closed, because then you develop a pocket of fluid called a seroma. This can also happen if we take the drain out too soon. That's why it's very important that your drainage amounts are down to a level that would not cause this collection of fluid under the skin. While you shower, obviously you can take the dressing off, and then you would have to replace it if you are still having drainage. If you have any questions at all, just feel free to call our office. We are available 24/7, and there's always somebody here that can help you out.